on the fire. We're cooking with gas. If you want to improve type 2 diabetes and insulin resistance with the patient, the best way is to modify their diet because the food we eat is the cause or the consequence of metabolic problems. So it's all a matter of shrinking fat cells. You can shrink fat cells through two different ways, as we've talked about. You can do it through restricting energy, or you can do it through restricting insulin. There are three ways to leverage this fact. One is a low-fat diet, which is basically a low-calorie diet. Every low-calorie diet is a low-fat diet. Alternatively, you could have the patient focus on the low-carb diet, which is going to lower insulin specifically. In that form of dieting, there's no calorie restriction. It's just manage your macronutrients in such a way to lower insulin. And then what kind of spans them both is this new phenomenon, although certainly an ancient practice, of intermittent fasting. Now, briefly, let's look at what happens as we compare the utility and the reasoning for low-fat versus low-carb diets, because these two are often pitted against each other, and appropriately. What happens with the macronutrients that we eat? This is the effect, the insulin effect. If someone eats fat, you'll recall we went over this. There's no effect. If someone eats protein, depending on their inherent physiology, there might be a small effect. If someone eats pure carbohydrate in the form of like bread, not so much vegetables, and maybe a little more so with fruit, but there's a large effect. So let me ask a question. In diabetes, which of these nutrients is the body struggling with? Do we define diabetes because of a patient's high triglycerides, even though they might be high? Is that the definition, the clinical cut point we're looking for? Do we define the diabetes based on the amino acids in their blood? Do we define the diabetes based on the glucose? I'm kind of belaboring the point, aren't I? Of course, when it comes to diabetes, we define the disease by its glucose level. It's no surprise then that there are reports, some from some of the most famous diabetes scientists ever, which is this case here, from a number of decades in the 1980s. This group published a report that took people with type 2 diabetes and put them on a diet that perfectly adhered to the recommendations of the American Diabetes Association at the time, which was a high-carb, low-fat diet. It's no surprise, is it, that they got worse? Unfortunately, this is a sentiment that persists. There are still many people that want people with type 2 diabetes to be on high-carb diets. This is a cynical take, but I'm your professor and I can give it to you anyway. That's a wonderful way to sell a lot of medication. Too much glucose is what they're struggling with. Why have them take a diet of excess glucose? This is thankfully being rectified, albeit far too slowly. But in 2020, the American Diabetes Association came out with its newest guidelines. And this is a direct quote noting that reducing carbohydrate intake for individuals with diabetes has demonstrated the most evidence for improving glycemia. It's no surprise. If this is a person who's struggling with blood sugar, put less sugar in the system. All right, now let's talk more about the low-carb diets. This is actually kind of long, and I don't know how much of it I need to narrate for you to get the point. But these are well-controlled clinical studies that compare the effects of some of these metabolic outcomes, and I'm showing you glucose, insulin resistance on low-fat versus low-carb diets. And you're going to see a theme here. So significant improvements. The insulin resistance went down by half as opposed to a modest one in the low-carb versus low-fat, respectively. This is a very interesting study for a few reasons. They had people in three different diet groups. Low-fat, low-calorie, the Mediterranean, which is slightly higher fat, but also low-calorie. So those were two diets that were calorie restricted. And then lastly, they had a low-carb group that had no calorie limit. And they were told to eat a diet that was only 20 grams of carbs and eat as much of anything else as they want, as much protein and as much fat as they want. But it's interesting, you'll notice here, that they actually increased the amount of carbs the subjects were having, by 6 times, up to 120, which is pretty easy to do, actually. Because they said this in the study. It's fascinating. Get the study, there's the link at the bottom, or not the link, but the citation, and read it. Because they were losing too much weight. They considered it too problematic that they were losing so much weight, even though they were eating as many calories as they wanted. But in all of these markers, the low-fat, low-calorie diet was the worst performer. In the low-carb, uncalorie, unrestricted diet, which became kind of moderate carb by the end, not really low-carb at that point, it was the best. And similar overall effects being seen with the insulin resistance and insulin levels improving consistently much better on the low-carb diets versus low-fat diets. This study showing more of the same. This study is actually compelling enough that I need to take a moment to explain it. So they took people and noticed what group they would be in. Controlled for body weight, equal body weight. There was an insulin-resistant group who had an insulin level at around average of 16 microunits. You know that 6 is what I consider to be a healthy limit. And the insulin-sensitive group, which was considered to be at 5 microunits per mil. And they put them both on a low-fat diet and found that neither group really had any change in insulin. Then they put them on a low-carb, but the insulin-sensitive group, they don't need a good change of insulin. It didn't change significantly and it didn't need to. But the insulin-resistant group, they did need to change. When they put the groups on the low-carb diet, once again, the insulin-sensitive group didn't really see the needle move much. It doesn't need to move much. Now, however, when they did the same with the insulin-resistant group, there was a very significant drop. And then the same study, they looked at the amount of body fat these people had. No significant difference between the two, statistically speaking. On the low-fat diet, but that's a pretty good amount of fat. On the low-fat diet, the insulin-resistant group had an insignificant 1% reduction, whereas the insulin-sensitive group had almost a 3% reduced body fat level. When they moved the patients over to the low-carb group, or the other group with the low-carb diet, once again, the insulin-sensitive group lost about 3%, a little more than 3% this time. And now, all of a sudden, the insulin-resistant group had a significant amount of fat loss. And just to sort of focus on the fat loss for a moment, because if you lose fat, you were shrinking fat cells. They identified people, and they gave people glucose. that were insulin sensitive or insulin resistant. The insulin sensitive people had a modest increase in insulin to handle the glucose load, the oral glucose tolerance test, and the insulin resistant people had a much higher insulin release. That's no surprise. And then they noted who lost more weight on either low carb or low fat diets. Well, the insulin sensitive group lost weight on both diets. It didn't matter which diet they were on, low fat or low carb, they lost weight. However, the insulin resistant group lost 2 times more weight on the low carb diet versus the low fat. In summary, if we were to take all of the randomized controlled trials that have been published on low fat versus low carb diets, we would find the following. Greater fat loss was found 48 times in the low carb diet, with 7 times favoring the low fat diet. Of course, that's just general weight loss. It's not looking at, and then 3 finding nothing, no difference. But if we look at the ones that reported statistically significantly greater fat loss, I'm just mentioning all of the findings, even though it wasn't statistically significant. 29, so a little more than, about half exactly, found that the low carb diet resulted in significantly more fat loss. And the number that found more fat loss on the low fat diet was exactly 0. There's never been a single paper published that has found greater fat loss on a low fat diet, significantly greater low fat diet, more fat loss than on a low carb diet. And if you'll allow me to be a little funny for a moment, even from the very, very first ever published clinical trial from Daniel, chapter 1, this is the first report that I'm aware of, as I have been a rigorous scientist, that compared the effects of a low fat versus low carb diet. And when Daniel and his compatriots decided to not eat the king's meat, they of course were subsisting on a diet of grain, which of course is pure carbohydrate. Well, at the end of the 10 days, it's a pretty short clinical study, but it's done before, they were fatter. I'm being a little cheeky, guys. Don't take this to your ecclesiastical leader as if I'm invoking some law of the world here. All right. Now, intermittent fasting is one that spans them both. And it shouldn't surprise you that if you can get a type 2 diabetic to undergo some degree of intermittent fasting, things are going to change, and they're going to change quick. This paper reported that within just a couple of weeks, they were getting off all of their medications. Intermittent fasting is very powerful. If there were more studies published on this, I would share them. There just are not a lot. Although I think more and more will be coming as fasting is increasingly acceptable as a therapeutic intervention in people with type 2 diabetes. All right. Once again, we've covered a lot of important stuff. And indeed, we've come to the end-induced version of type 2 diabetes. This is gestational diabetes.